as you get to talk to the CEOs of all these big companies and the smaller and mid-sized companies, what is the, for years, for decades, we've talked about, well, we can't just keep driving up the price of pharmaceutical drugs. Yes, we need to have innovation, but at some point, there's going to be a tipping point. At some point, there's going to be a reckoning. Is there any sense that that reckoning is closer at hand than it used to be, given all the activity in Washington, or is it still pretty much the same business model?
I would say the business model as of now still the same. I mean, the companies and the industry are very actively considering all the different scenarios. The policy side is a big question mark. We've been talking about drug pricing for I don't know how many years, right? Every time when we get closer to some resolution, then it just doesn't happen. I think it needs some change on the policy side. Right now, I think there's the incentive system is not right? Some of the incentive system, it actually encourage higher price because of the rebate system. And meanwhile, the R&D productivity is still an issue, so there's a huge investment needed for one successful drug. Ultimately, that could improve, given I think we have a huge amount of the genetic information that really helps the industry have much more in-depth insights in what causes diseases, and ultimately that should drive higher R&D productivity with the technology integration, but that's a process. Particularly on the drug pricing side, I think policy clarity would be a biggest question, and then the industry can adapt some of the business models accordingly, and ultimately the R&D productivity will be, I think, the ultimate